Hi, everyone. Welcome to Get Well with Dr. Shel. I am Dr. Shalene Alalji, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Hello, everybody. Today we have a very special treat. Get ready for an amazing introduction. My guest today is a nationally acclaimed expert in women's wellness and menopause and is a member of the Harvard Medical Faculty. Dr. Mache Seibel is a leading author of two best-selling books, The Estrogen Window and The Estrogen Fix. And he's the editor of the #1 digital magazine for midlife women, HotYearsMag.com. I love that title, Dr. Seibel.
Thank you.
Before transitioning his career to focus on menopause, Dr. Mache was a leading expert in infertility, performing one of the first in vitro fertilization successes in the United States. Dr. Mache has published over 200 scientific articles and 17 books for professionals and patients, and he has received multiple national awards for patient education, research, and innovation, including the Media Award from the North American Menopause Society for advancing the understanding of menopause in the United States. He's board certified in gynecology and reproductive medicine and an NAMS certified menopause practitioner. In addition to seeing patients in his office, Dr. Mache is a sought-after speaker, consultant, and menopause coach at menopausecoaching.com. Welcome, Dr. Mache. So good to have you here.
Well, thank you for having me. It's a pleasure.
Absolutely. And we're going to have a special treat for the listeners in a little bit where you have some amazing talents, and we will be demonstrating that to our listeners. So I hope everybody's all ready for that. So let's jump right in and talk about how you personally got started working specifically with menopausal women.
Well, I was very involved in the infertility world, the first of my career. As you mentioned, I did some of the first IVFs. I was one of the people that developed the ultrasounds that you go in and get now, and had a role in developing those ovulation and pregnancy tests that you go in the drugstore for. The original work, I was involved in all of that.
Wow.
But what happened was my wife had surgery that threw her into early menopause. And that happened only a few months after the Women's Health Initiative came out, the WHI study that we now know incorrectly suggested that hormones can increase the risk of breast cancer.
Right.
And so what ended up happening was her doctors were reluctant to treat her. And as a result, I really transitioned at that point in time from the infertility side to the menopause side. As I say, I used to do sperm to term, and now I do womb to tomb.
Okay.
But I was very interested to make sure that she and my patients were getting the right information, because I had been doing infertility for a while, and a lot of my patients ended up staying on beyond their fertility years into the menopause, but particularly for my wife, who was really in need of figuring this out. So that's how I transitioned and why.
That's a great thought process and a great way that you had your journey, because, you know, a lot of us, we have personal situations or circumstances that present our missions to us. And, you know, it's like I say to everybody, we don't choose our mission chooses us. And both of us being gynecologists, I know women's health is very near and dear to our heart. And I know that your beautiful wife is a cancer survivor and thriver, just like myself. We're both warriors. And I know a lot of our listeners get concerned when they hear hormone replacement because of specifically 2002. You know, you and I were both practicing. And at that point, our phones were ringing off the hook because the study had come out, WHI, and then everybody was thinking, oh my gosh, I need to get off my hormones. But what do I do now? So
Right.
fast forward 18 years now, what are we telling patients about what the study showed, what the reality is, and how women should approach menopause?
Well, I'm going to start back where you left off there first, just very briefly, because on that morning when the phone started ringing, what really happened was there was one paper in Pittsburgh that released this advance notice of this study results ahead of the deadline. A lot of times you get a notice of something and it's put under a hold until a certain date.
Right.
And so what happened is the data came out suggesting what we now know is incorrectly, that estrogen increased the risk of breast cancer, but they let it out before anyone had even read the paper.
Yes.
So what happened was there was a lot of panic, and it was really panic. The study itself was shown to be quite flawed. And the reason the study was flawed is not that they gave data that was bad. They designed the study poorly because the study was intended for women who were between the ages of 50 and 70s, in their 50s, 60s, and 70s. So from 50 to 79 were the women in the study. But it turned out that at that point in history, there were so many women already on estrogen, they couldn't find any women to go in the study. And so what happened was, of the women that received hormones, most of them, 75% of them, were between the ages of 60 and 79. Whereas the women who received the placebo were between the ages of 50 and 59. So what ended up happening is you were comparing women in their 50s to women in their 60s and 70s. And of course, women who are in their 60s and 70s are going to have more breast cancer and more heart disease than women in their 50s. It's just because we're older.
Yeah.
Now, what ended up happening was that when they went back almost 18 years later, quite a bit of time later, and they took the women, the 25% that were in their 50s in both groups,
Right.
and they compared the women in their 50s to the women in their 50s, whether they got a placebo or they got hormones, the problems disappeared. And what happened was it was a design problem that wasn't initially appreciated. But the outcome was that the women who received the hormones and were on them thought that they were being given something that was causing them cancer, and they were frightened. And of course, many of the reporters who were covering this story were women of a certain age who were taking hormones. They felt betrayed. And so they talked about it a lot. And it took forever. A generation of women ended up not getting hormone treatment or choosing against it. Whereas we now know that for the majority of women, estrogen is both safe and effective. But there is a caveat. And that's what my book, The Estrogen Fix, is about, and the one before it, The Estrogen Window. Because what we know is that there is a window of opportunity to begin estrogen. And if you start it closest to the time of menopause, so that you are beginning it near to where your own hormones started to go decline, it is in fact a very safe hormone for most women. What happens is the body ages, and if you wait 10, 15, 20 years, plaque in the artery starts to build up,
Right.
issues happen. Estrogen is no longer in the point of it switches from being preventive to
Right.
then a potential contributor to the problem. So
Right.
starting it later is where the problems came in, and the study design unmasked that, but the people who did it weren't aware of it.
So, you're at this wonderful institution. You're at Harvard University. And I think that as gynecologists, and I'm so happy that you spent a little extra time talking about the flaws in the study, because I'll be honest, I don't believe the majority of the menopausal population knows that that study was flawed, because it's not great news anymore and nobody's spending time talking about that. And I think once a woman does hear that particular aspect of the study, that it was indeed flawed, and no, it does not increase your chances of breast cancer, nor does it increase your chances of heart disease, it completely shifts perspectives, because literally, who wants to live with hot flashes and night sweats and vaginal dryness and insomnia and all the wonderful symptoms that we menopausal women go through? So what can we do to inform women of this? Besides, of course, us talking and your wonderful books, I feel like we have this responsibility to let menopausal women know. What do we need to do?
Well, there's a bigger problem than just the women not knowing.
Mhm.
During the course of my books, I did book tours around the country, and I spoke both to groups of women and I spoke to groups of doctors.
Yeah.
And I will tell you right now that
Mhm.
part of the problem is that in the general practitioner world, there are only about 10% of doctors that get any training in women's health, according to the New England Journal of Medicine.
Mhm.
And according to the journal Menopause, there are only about 1 in 5 or 20% of gynecologists that get any training in menopause. So
Wow.
you have people who are the providers of information who
Mhm.
many times are learning from the media and from uh, old information
Right.
the same way the patients are. And
Right.
so the doctors, I know in Boston at one point, when estrogen was thought to prevent heart disease,
Mhm.
they were giving it to everyone. And when this study came out initially, doctors went from just about giving it to everyone to uh, asking for informed consent to give hormones. So you have to sign a paper saying that I understand the risks and benefits of estrogen. Now, there's another caveat in the estrogen story, because women who take hormones are divided into two groups. There are women who have had their uterus removed. In other words, they've had a hysterectomy.
Mhm.
And there are women who have not had a hysterectomy.
Right.
Now, the difference is that the women who have still got their uterus require taking estrogen together with another medicine, progesterone, or a synthetic progesterone called a progestin. It's just what we call
Right.
synthetic. As you know, synthetic progesterone is called a progestin. Acts like progesterone, but it isn't that. It turns out that if you look at the group who have had a hysterectomy or their uterus removed, they only require taking estrogen because the progesterone is there to protect the uterine lining from developing abnormal cells that could lead to cancer. And that's why women who have a uterus need both. If you
Right.
take both, there's not a risk. But women who've had their uterus removed only need estrogen. Well, it turns out that the women who have had a hysterectomy, in fact, not only don't have an increased risk of heart disease and breast cancer, they have a reduced risk. And estrogen actually lowers the risk
Mhm.
substantially by about 20, 23%. So this is a very different story, whereas it's rather neutral for women who get estrogen and progesterone.
Mhm.
So the story is getting the message out is a very, very difficult challenge. It's one of the reasons I'm here talking about this now. and why I've been beating drums for a long time, because sadly, this information isn't common knowledge to at least half of the doctors that are
Right.
out there, maybe larger percentages depending on their area of expertise. And for women, I would say it's an even larger number who
Right.
don't know. And because if you look, estrogen in 2002, when the Women's Health Initiative came out,
Right.
estrogen was the number one medicine in the world.
Yes.
It was, at the time, it was about a $7 billion medicine.
Yeah.
Today, compared to the number of women that were taking it back in 2002, there's less than 10% of women are taking hormones. Now, I don't have any affiliation with any hormone companies I'm not selling hormones of any kind.
Right.
But I will tell you that as a result of this, women have felt that they needed to tough it out. And my ambition, my goal, my passion has been to help women figure it out so they don't have to tough it out, because it is entirely possible to go through menopause and have relief either with estrogen, which is highly effective for most all of the symptoms, but if not, then women need to understand that they don't have to suffer silently. They can get options to hormones by non-hormonal prescriptions, or by lifestyle changes, or by other kinds of medications or treatments that can offer them relief. What they shouldn't do is just think it's normal to feel bad and to suffer when there are things they could be doing.
Absolutely. And I'm so glad that you made that point, because if you look at our life expectancy now, women and men, our life expectancy is well into the 90s and hundreds, right? And if you are going to live literally half your life or close to half your life in menopause, why would you want to suffer in silence? Why not be proactive? Why not be your own advocate and not necessarily always count on perhaps the doctors that may not have looked at the studies in the way we're speaking about today, and they're looking at old information. So what I always say to my patients, and I think this is super important for both of us having this conversation, is be your own advocate. Never ever feel that you should be resigned to suffering with the symptoms of menopause when there are options out there. Now, the options, just like you said very nicely, is, hormone replacement, either with estrogen and progesterone. And I'm a big fan of bioidentical hormones. I know you also do practice prescribing bioidentical hormones as well as others. And I really do like to customize my patients' prescriptions with bioidentical estrogen and progesterone, and if they need testosterone or DHEA, and just really trying to balance their health and well-being so that they become more asymptomatic and thrive and have energy and vitality and proper libido and sex drive and good skin and good collagen. So let's maybe talk about that a little bit. Is what are some of the symptoms that you see a lot of women suffering from? And what are some of the options that are safe and effective that they should consider, whether it's hormones or alternatives?
Well, always you have to start with what the person wants.
Yeah.
And what they want may be colored by what they believe.
Mm-hmm.
So the first thing that you have to do is understand what it is, the patient's awareness, what's the woman understand about hormones, risks, and benefits. All you can do is offer the information, and people can choose to take it or leave it.
Right.
But what I'm saying is very well demonstrated, very well studied, and I am not in any way confused about what I'm talking about. So I would say that estrogen is safe for the majority of women. However, the symptoms are varied, and they may be, the common ones are hot flashes, which can be anywhere from occasional to every 5 to 15 minutes. So they can be highly disruptive. And as a matter of fact, if you look at hot flashes and the impact on women, women like to think of them as just a nuisance.
Yeah.
But the fact of the matter is that is not true. First of all, we know from studies that are involved in women with hot flashes, just to say in the workplace. There are studies that look at women who have hot flashes in the workplace who either are treated or not treated. And we know that women whose hot flashes are not treated are most likely to take an additional 6 doctor visits per 12 months and leave work and not be as effective, not be as well rested, not be able to perform at the same level because they're exhausted.
Right.
It's also embarrassing for women at work. But hot flashes as a public health problem in the United States, if you amortize the cost of this study to the women with severe hot flashes, moderate to severe hot flashes in the United States, hot flashes is costing this country $14 billion a year in healthcare costs and direct and indirect costs. That's not a nuisance. That's a big issue.
That's a big problem. Absolutely.
Other kinds of problems that are very common indirectly because of hot flashes is sleep, but it can be also, sleep can be disrupted because estrogen is also responsible for some of the rapid eye movement in sleep. That's a restorative part of the phases of our sleep cycle. Many women will have a sensitive bladder, sometimes because of estrogen, but sometimes in spite of it. Not because of estrogen, but because of lack of estrogen, or in spite of it. And there may be other causes. So waking up a lot to go to the bathroom. Sometimes women are troubled by sleep apnea or restless leg syndrome, where they just suddenly have to jerk their leg and it wakes them up. And sometimes they sleep with somebody who's got those issues. And so that can wake them up. And then anxiety and depression, mental health issues, or can be compounding sleep issues, or can be issues on their own. So mood and mood swings that keep women going from the loveliest person like you always knew her to be someone that could be someone who would be described differently at that moment. And those can vacillate back and forth in the course of a day. So those are, those are some of the most common. Sensitive bladder, as I mentioned or alluded to, but there are many other symptoms. Some women will have hair loss, dry eyes, skin changes. They can have, you could just start with mood and dry eyes and then go down to thyroid changes, hair changes, breast changes, problems with just move right down the body from head to toe. And every organ, almost every organ, has got estrogen receptors, meaning that estrogen does play a role in those tissues and organs. And as a result, a lack of it can cause a symptom in that area.
Well, I mean, you did a beautiful job, summarizing that. And that's all kind of telling us women, telling all the women that are listening to this, is everything that you're feeling is normal. It's not in your head. Don't let anybody tell you it's in your head. It's physiologic. It is a deprivation of the hormonal balance that your body is essentially craving. And when you have sleep deprivation and mood swings and anxiety and depression and all of the embarrassment or the conditions that you're going through, you really can't live the best life that you want to live. And I think that that's a disservice to women during that phase of their lives. So if you have a female who comes to you and
I think, may I interrupt you for 1 second to add one point?
Yes.
I agree 100% with what you said, but I would only say this. In addition, when you are suffering from something you think is very much may be due to menopause, like hot flashes, you have to also remember it could be something else. So if that's why don't think anything is a nuisance, go get seen, because you could be feeling warmth from a thyroid problem that's too low, or from diabetes that's got you with the low blood sugar. There are a lot of other things that can be causing many of the symptoms. So
There could be
yes,
overlap between the different conditions.
yes, and those things tend to show up around the age of menopause.
Absolutely.
So I just want to pitch that just because it looks like menopause, it may not be menopause, and just because you don't think it's menopause, it actually could be menopause. So
Exactly. Well, I think the point to kind of take from this is to do a comprehensive evaluation, to look at everything starting from sex hormones to thyroid hormones to perhaps even your adrenal hormones, as well as your, fasting insulin, hemoglobin A1C, vitamin D deficiency, to really looking at an entire comprehensive picture and to seek out a physician or a practitioner who will be there for you during the journey, really listening to you, really taking your history and your symptoms into account, as well as looking at all the lab results to come up with what truly might be going on.
right. I mean, I've had several patients through the years where their vitamin D was so low
Yep,
that, in fact, treating it corrected their hot flashes.
exactly.
So there's
Magnesium is another big one. I mean, if somebody is so
magnesium.
deficient in nutritional,
Yes.
levels, then you can certainly have other symptoms that may overlap or seem like something else. A lot of women treat their hot flashes with, black cohosh or magnesium or other such things, and everything is unique to each individual. So I think being in touch with your body and your symptomatology and really having a practitioner who can walk the journey with you, I think is wonderful. Um, let's shift gears just a tiny bit. It's World Cancer Awareness Day, and I myself am a cancer survivor and a cancer thriver, I like to say. So is your beautiful wife. How do you counsel your patients who've had breast cancer?
Well, it depends on what it is that they have, which breast cancer is not one thing.
Sure.
Breast cancer can vary by the cell type and it can vary by the severity, the aggressiveness of it. And so uh, it's hard to put a general response to that. But I would say that there are some women who have had breast cancer that can take estrogen. Those
Uh-huh,
are specific cases, and that has to be individualized.
uh-huh.
But even women, one of the big issues with breast cancer is many women will have dry vagina
Mhm.
because they have gone through a lot of treatments, and
Sure.
vaginal dryness is a very common and very painful potentially
Mhm.
symptom. And the reason I bring that up is because it is possible for women who are breast cancer survivors, even estrogen receptor positive ones,
Mhm.
if other things don't work,
Right.
then it is possible to take vaginal estrogen and
Mhm.
to use that locally. And so this is a big thing because there will be oncologists who are afraid for women to take even that because about 1% of it may get into the bloodstream and they concern themselves with that.
Right.
But according to the American College of OBGYN and a report and a review that looked at the risk of recurrence and the risk of death in women with breast cancer who took vaginal estrogen,
Right.
there was no increased risk of either death or recurrence. There are no reports of increased risk of death or recurrence. So the belief is try something else first, and there are a number of things to try. But if that doesn't work, then it is possible to use estrogen, and that's a reasonable consideration. But the difference is for women who can't take estrogen, you have to look at the woman very holistically because estrogen is a interesting hormone because if you are able to take it, if you are having issues of the brain in terms of mood or in terms of fog, brain fog, or other things, estrogen will affect it in a favorable way. If you have issues of a sensitive bladder, it can be helpful for that. Dry vagina, helpful for that. The hot flashes, helpful for that.
Right.
So the point is, if you're worrying about your bones thinning, then estrogen can be helpful for that. It's actually approved to prevent osteoporosis.
Yes.
But if you're not going to take estrogen, then you've got to look at your body separately and not as one thing that a pill goes everywhere, but where each part needs additional assistance. So hot flashes may require one type of treatment. Bone health would require another. And I will say to women that you should definitely have your bone density checked particularly if you had breast cancer, but even if you haven't, because if you're a healthy 50-year-old woman, you are just as likely to die of a complication of osteoporosis as you are of breast cancer.
Right.
And most women are worried about their breast, understandably, but they don't realize that their bones are what I call the silent symptoms. They're noisy symptoms like hot flashes, but they're silent ones. And bone disease is one. Bone health is one of those. Another is a heart disease, because you're 10 times more likely to die from a heart problem than you are from a breast cancer problem.
Absolutely.
But the treatment, therefore, has to be individualized. You have to look at all of the things that you need to help prevent. And so you need to look at the symptoms that are most worrisome. And then you have to work through whatever it is that works for that woman, because women will not all respond equally or the same to the same treatment. So you have to, do this in a phase kind of way, so that you can work with them. And it's not a quick fix. People want you to try this, and if this is good and that is good, let's take both of those, or let's add another thing. But my philosophy is, the slower I go, the faster I get there. And so I try to do one thing at a time, work on one thing at a time, and see where I am in another month or two. And then do it again. Because otherwise, you don't know what worked and what didn't work, or what worked for one thing and didn't work for the other thing. So it takes a little bit of a strategy and a plan. When I do menopause coaching with women, that's part of what I do, is go through these as a strategy, because they have to have a strategy, or as patients if I see them. But the point is, take your time, get the biggest symptoms first, address those with what's available that's acceptable for the woman, for her risk and benefit, and just take it from there.
Yeah, absolutely. Great advice, because everything has to be customized and individualized, and it's not a one size fits all protocol.
No.
Take your time. And, I think it's great that physicians more and more are getting in tune with customizing approaches for the menopausal women, so that they look at every different aspect of their symptomatology and their chronic conditions. So those are great words to really incorporate into your long-term health and well-being plan. I want to talk about your magazine before we end today, because it's super exciting to me. You've launched the Hot Years magazine, which show it to us. All the viewers need to see this.
Yeah,
Yes, it's gorgeous. I love that red on that magazine.
Here's
Beautiful.
Belinda Carlisle from the Bee Gees.
Yes.
We have the Hot Years is really I'm very proud of the magazine, because it is easy to understand. And I cover a lot of the meetings, and I go as press and actually interview people. So we actually, many of the issues will have interviews with other speakers in video form, so you can click on it digitally and actually see the video. And we put, it has recipes, lifestyle, is usually exercises.
Yes.
And we have some really terrific exercise specialists that'll give some like 1-minute exercises that women can do even at their desk at work, because they're not egregiously, everything isn't a push-up or a jumping jack. There's a lot of things that you can do.
Right. Stay healthy while you work. I think it's great. And what I love about your magazine is it gives wonderful tips that can be used in your lifestyle on a daily basis. And it makes it easy. It makes it very adaptable to a busy lifestyle. And it's a really terrific resource for women. So glad that you chose to undertake this huge challenge, because it's a wonderful area of information, vast information from an expert like yourself. So kudos to you. And I'd really...
my wife is my associate editor, so together we do the magazine. It's a quarterly magazine, and but it's available at hotyearsmag.com.
That's great.
And
Great. I would definitely suggest for all the listeners to go check it out. I've checked it out and it's amazing. And I think it's a great, great resource. Before we let you go, this is the treat that I think that everybody's been waiting for. First of all, I want to thank you, Dr. Seibel. You can, audience, you can find a wonderful short quiz that Dr. Seibel has created at menopausequiz.com. To learn more and to gain insight into your own hot journey. And before we end today's wonderful session and podcast, I'd love to request you to sing a beautiful song for our audience. Dr. Seibel is very talented and he has so many different talents. He actually sings to his patients and he has done so
not
many
in the exam room. No, but
When
in presentations I do.
Yes, there you go. But you
That's
have a
church and state. Can't mix those two.
That's right. Yes, right. You have a very, very unique approach and so entertaining. So I want to say thank you for being here. And I'd like to,
Pleasure.
end our podcast with this beautiful performance. Thank you so much. It's all yours. Take it away.
All right. Well, this is a song I wrote. It's a fun song. It's about growing old gracefully. Because let's face it, both men and women are worrying about getting older.
Yeah.
And this is called Growing Old Gracefully. So hope you like it. Well, back in the days for liposuction, tummy tuck and facial reconstruction, we all learned to live with what we got. Before Botox and facial peel, white shade of our teeth was real. We'd like to live with what we got. You could tell a book by its cover. You could tell your sister from your mother. Biggest goal I did not used to be looking 30 at age 53. Well, back in the days for keratoplasty, wearing glasses wasn't nasty. All we really wanted was to see. We didn't try to fool no one. We worried less and had more fun. We learned to grow old gracefully. You could tell a book from its cover. You could tell your sister from your brother. Biggest goal life did not used to be looking 30 at age 53. We learned to grow old. We're all gonna grow old. So let's learn to grow old gracefully.
Woo! I love it. That was amazing. I absolutely love that, Dr. Seibel. Thank you so much for sharing your talents with us. I've got to have my kids listen to that because they both love guitar and you just knocked it out of the park. It was awesome.
Well, thank you.
Thank you for being on with us.
It's fun being with you, and I appreciate very much you having me on. And I hope your information will be helpful to some of your listeners.
I'm sure it will. Thank you so much for your time and have a blessed day, everybody. Take care. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.